health. So those social and economic opportunities play a vital role in a person's health over their lifetime. Studies have shown that there's a definite correlation between employment and health status, that employment increases health status both psychologically and financially, improve health overall. Studies show that healthy people are more likely to work, and that health definitely plays an impact on an individual's desire to work and the likelihood that they're going to keep a job once they have a job. I think this is an interesting study too, that individuals who increase exercise, especially the study was on individuals with physical disabilities, those individuals that increased exercise and increased their overall health by decreasing secondary health conditions actually increased their likelihood of being employed by 8.4%, which is pretty phenomenal, really, when you think about it. So, that's why we wanted to look at the connection between health and employment and do what we can on our end through Project Search to not only increase health awareness for the overall benefit of health awareness, but to also help our interns to have an increased outcome in obtaining and retaining employment. So I'm going to pass it over to Jillian for just one second, folks. Let's see. There we go. Okay. Jillian?
Thanks, Sandy. Hi, everyone. From a global perspective, I did want to share that UnitedHealthcare Community Plan of Texas is the branch of UnitedHealthcare that is responsible for those individuals in our state that are enrolled in Medicaid, CHIP, and dual special needs programs. So that would include the individuals in long-term care. That would include individuals in any Medicaid waivers. We also have individuals in the Medicaid, Medicare program demonstration that exists in several states through CMS. And so through the work that we do to support over 300,000 Texan lives, we realize that we have a unique opportunity to improve health outcomes through person-centered care. And part of this person-centered care is including the desire to work. And we realize that there's actually a twofold aspect to employment and healthcare. There's the need to keep people healthy so they can maintain employment. And there's the understanding that part of a person's satisfaction and healthcare outcomes is fulfilling their desires. And one of that desire can include housing. It can include they love to cook. It can include I love to work out. And specific to this conversation, it's that I want to work. I want to have a job. I want to go to this location. This is what I want to do with my life. And so we are starting to see in the healthcare area this kind of transition from you need to go to the doctor, you need to have your preventative care to keep out of the hospital, you need to take, see a psychiatrist to control depression or other behavioral health issues and stay healthy so that you can stay out of the hospital, to what's actually happening with those people, what's actually happening with people who are going to the hospital, potentially for social interaction, or what is causing depression and could help someone at a global level, and realize that the impact of healthcare is so much more than going to have your annual exam or having your vaccinations or making sure you're abiding by your diabetes regimen, for example. And so we're seeing this conversation happen now across the spectrum of responsibility, from the federal level to state level to now health plan levels, of how employment directly impacts healthcare outcomes and our responsibility as healthcare providers and healthcare managers to support individuals in maintaining that employment through healthy living. And so when we talk about how UnitedHealthcare is supporting that, some of that comes from federal government changing basic rules and providing funding. Some of it is from partnership with our states to make sure that our states understand the importance of this. But really it's somewhat of a responsibility we feel of demonstrating through employment how we can demonstrate, how we can show these positive healthcare outcomes, which then would lead to funding. And so employment is a conversation that we have with all of the social determinants of healthcare, realizing that when someone is unsatisfied with their life, there are impacts, just as there are impacts to employment and housing and other things when your health deteriorates. And so we are dedicated here in finding ways to create that synergy between how do we keep people out of the hospital, happy and healthy at home in a location that's least restrictive, and how do we keep people healthy enough to maintain work and maintain their personal relationships and maintain their happiness. And it's kind of this inner web of processes and dependencies, if you will. And so we have started seeing employment even before programs such as Employment First were coming around and being added to our waivers. As specifically in Texas, we have Employment First as a benefit of our surplus waiver, or now HCBS waiver members. We started having those conversations with members already as far as, you know, what's really going on in your life and what really do you want to do, and how do we get you where you need to go. And so these conversations around employment and housing and food and banking and kids and school and all of that became part of our assessment process. And we actually view it as being one giant whole person-centered model of how we support people in making healthy choices and making lifelong choices that support their happiness and their connection to who they are in their community. And so when we look across this, we are looking to change multiple areas of that continuum. We realize for us, this is something that we have a lot of control over in our space as far as assessment and connecting with our agencies to find employment and have training. It's critical that we have programs like Project Search, where we're helping young adults moving from high school to employment and adulthood and college, and supporting them in a holistic perspective of not just employment skills, but healthy living and social skills, and how do we learn just the work we've all done in employment. It's that same mindset of teaching just general, it takes a village to kind of raise up a village, and that's the philosophy we have, and that's where HealthMatters becomes such a critical part of our mission and the delivery we have to help people live healthier lives. So as we move on to the next slide, there's a number of things just from a perspective of what this means to UnitedHealthcare and the merger of, or the synergy, I guess, not merger, the synergy of employment and healthy outcomes. We have, across many states, committed to employment as a number of social determinants of healthcare, where we're investing our time, our money, our minds, our innovations to support. And so we have a couple of things, for example, person-centered service coordination. In other states, this is called case management. In Texas, we call it service coordination. These are nurses, RNs, LVNs, social workers, sometimes community health workers, who are supporting our members in coordinating the full gamut of services. Healthcare services like doctor's appointments and long-term services and durable medical equipment, but also their community resources and how to keep them happy and healthy in the environment they're in. So employment becomes critical. We do have the administration of our Employment First benefits. That is part of our HCBS waiver in Texas. That used to be our Star Plus waiver population. The name's in the middle of changing, as well as our collaboration with Project Search. We're looking to find ways to support young adults moving into the adult community and finding their greatest passion, as well as creating those job opportunities. And of course, looking internally at UnitedHealthcare. How do we make it easier for individuals with intellectual or developmental disabilities come and work for one of the largest healthcare organizations in the country and be able to support them long-term with their employment goals, with their healthcare goals, with their social goals. And that's something we take very seriously, and we are continuing to evaluate and look to expand our commitment to Project Search and our commitment to helping all members and employees live a healthier life. So Sandy, I think that's it from an overview perspective. I think I'll hand it back to you.
Great. Great. Thank you, Jillian. Okay, moving on. Okay, just as we wanted to talk about just a little bit about our collaboration with Project Search. Of course, we have our site in Texas at the Texas Community and State Health Plan, but we also have some various kind of I'm sorry, I'm losing my train of thought here. We have just a variety of ways that we're trying to collaborate with Project Search. We have our site in Texas, and we also are working on a second site in Arizona. We are very interested in having other Project Search sites around the country to include us in their business advisory councils. We would love to participate. We are 100% invested in assisting individuals with developmental disabilities and intellectual disabilities to find employment. So this would be a good way for us to collaborate with other sites. We are also, excuse me one second. We are also doing our part to help Project Search interns around the country with developing those skills that they need to be successful in the workplace by providing an email mentorship program for them. Kim Nettleton is the person that you would need to contact for to participate in that program, and we can make sure that that information gets out to you. But the email mentorship program is a great opportunity for interns to receive an email from someone outside of their daily routine, someone that they normally communicate with, and develop different ways of using email, not only from a business perspective, but also to learn what's appropriate and inappropriate to communicate via email, and to just build those interpersonal skills as well as those business skills. We're also looking at collaborating with Project Search to help find host businesses. That's something that we're exceptionally interested in. We're looking at being a host business for not a host business, but a rotation site for other sites around the country. To be that third rotation site, we'd really like to be an externship opportunity for sites around the country. And of course, we are a host site as well in Texas, and we're working on a site in Arizona. We have big goals for expansion around the country that, I'd love to share, but, it's something that we're really working very hard towards. And of course, then finally, we have provided, UnitedHealthcare has provided the health and wellness curriculum, which is HealthMatters, to over 400 sites around the country. And we did that at the 2015-2016 Project Search Annual Conference. It's a exceptional curriculum developed specifically for the IDD population, and we have been using it. Last year was the first year that we used it in our site, and part of this presentation, the reason we wanted to do it is because we wanted to see how other sites around the country were using the curriculum. We believe in it. We know that it made a difference in how our interns approach their daily work at UnitedHealthcare and how it impacted their life overall. And we want to see it used as much as possible because it is such a powerful tool. Let's see, okay. Okay, moving on. So as a stakeholder in Project Search, we feel like there's a certain amount of responsibilities that we all share, and we just wanted to take a moment to kind of look at those. As stakeholders in Project Search, we definitely believe that we have a responsibility to increase health literacy of all of our Project Search interns, because we do know that connection between health and sustained employment. And health it impacts all facets of someone's life, so not just employment, but really the quality of life. So as a stakeholder, we're looking at the whole person in our interns. We want to make sure that, we're considering independent living and how they're addressing money management and time management, and all of this is we're looking at, like I said, the whole person. By providing health education, we're also helping to close the gap between the social determinants of health that impact our individuals with disabilities that we serve. So we want to make sure that we're giving our interns all of the knowledge that they need to have that quality of life that they're seeking. We're looking to aid in the implementation of health education. Last year, UHC, as we said, donated 400 copies of the HealthMatters curriculum to Project Search sites. Also, through health education, such as HealthMatters curriculum, the Project Search interns have a greater chance of achieving sustained employment. We've already said when people feel better, they show up to work. When they feel better, they do a better job at work. When they're working, they're able to afford better health care. You know, it's both sides of the equation. And finally, UHC is supporting the Ohio Project Search sites in a bid for a 5-year grant to study the impact of HealthMatters, the curriculum in the programs specifically in Ohio, and we're looking to be able to show the overall impact of how health literacy impacts the individual's overall ability to obtain and sustain employment in a long-term kind of way. Okay, so this is how we, you know, looking at HealthMatters, we really wanted to know everything we could about it so that we could implement the program as much as possible. So we took, all of our on-site team read the book from beginning to end because, you know, we wanted to really be able to implement it to its fullest. So HealthMatters is the exercise and nutrition health education curriculum for people with developmental disabilities by Beth Marks, Jasmina Cicerak, and Tamara Heller. It is based on a successful program developed at the University of Illinois at Chicago. It is a 12-week program and includes not just health education, but exercise and nutrition as well. It is full of supplemental lessons that were requested specifically by individuals with IDD, and the topics have a very broad range from self-advocacy to, you know, rights and responsibilities, using technology, various aspects of what all goes into determining one's health. The goals of the program include improved fitness and increased knowledge about living a healthier lifestyle, and teaching those around individuals with disability to help these individuals live a healthier life and to achieve a healthy living. Of course, the outcome of the material is that the individuals who receive this instruction will have a greater life satisfaction and, of course, increased knowledge and confidence. We definitely saw that with our interns. We implemented the curriculum in lots of areas, and the impact from the beginning of the implementation to the end of the implementation was pretty dramatic. We had interns who really started to express a concern for their health, which prior to the implementation of the curriculum, they didn't necessarily show that they cared. So it was a great kind of revelation for all of us. Excuse me. So these are just a few suggestions for incorporating the HealthMatters curriculum. We aligned the HealthMatters curriculum with the Project Search scope, sequence and scope within the curriculum. And for the first little suggestion we have that for Unit 1, which is the team building section, the course Lesson 24 is an overview of determining someone's wants versus needs, and that helps to demonstrate the ability to communicate personal needs. Not all, individuals with developmental disabilities and intellectual disabilities don't necessarily understand the difference between a want versus need, and you really do need to understand that to be able to express and communicate your own needs versus your own wants. Lesson 27 is all about negotiation and compromise, and that really helps in the project search instruction of demonstrating the appropriate way to solve a conflict with a team. You know, that's definitely a component of team building. You have to be able to compromise with your peers and to be able to negotiate your needs versus your wants and be able to express that without conflict. In the Project Search Course of Study 2, the Workplace Safety, Lesson 25 is a good lesson on how to know good pain versus bad pain. And understanding workplace safety is pretty critical to having a successful program and for interns to be able to go on and once employed out in the community, they need to understand how to be able to talk about how they're feeling, what's good, what's bad, and to be able to feel safe in a work environment. The course of study Unit 3, Technology. Like I said, there's various ways of teaching technology, and in Lesson 6, there's a fabulous lesson about good nutrition, and the lesson includes going to www.choosemyplate.gov to learn about how to structure a meal and what's good to eat and what's bad to eat. And again, that's a pretty valuable lesson. We had interns who, if they could have, they would probably lived out of the vending machines. And so we had to do a lot of instruction about how the interplay between what you eat and how you feel and how you perform. So we used the myplate.gov site and this lesson to not only teach that lesson about eating right for good health, but to also help teach technology and how to use technology appropriately in the workplace. Okay, moving forward, we have in the course of study 4, the self-advocacy lesson. The understanding one's own disability is pretty crucial to interacting with others and interacting with the world and knowing how to accommodate, ask for accommodations, how to advocate for yourself. And lesson number 9 in the HealthMatters curriculum is What Do I Think of Me? And it covers disability, identity, and culture. There's a video that you can access, and it was pretty powerful for us. Most of our interns came into our program with really not understanding what disability meant in general, and sadly to report that they didn't necessarily understand what disability they had themselves. So this lesson helped them to understand that even though they had a disability, that didn't really define them fully. The explaining rights and responsibilities is a very powerful lesson. Also, the self-advocacy rights and responsibilities lesson, Lesson A, we used that lesson pretty thoroughly last year since it was an election year, and we actually helped our interns to register to vote. It was a choice, obviously, a choice for them to make, and we went through the entire lesson about what is a right versus and a responsibility, and most of our interns chose after after the lesson to go ahead and register to vote. And not only did they register, we actually took them and they exercised their vote, their right to vote, and it was a pretty powerful experience for everyone, not just the first-time voters, but for us as onlookers to get to see the pride that they kind of felt by, engaging the community in a way that they had never done before. The course of study Unit 7 is, of course, health and wellness, which, of course, is pretty much what the whole book is about. So that's a pretty easy way to align the curriculum. Lesson 1 is a great lesson on general information about what is health. I would like to say, just as a former special educator, that not everyone really gets the same access to curriculum. It's not universal. There are good teachers, bad teachers, and so what many of our graduates from high schools around the country are learning about health is limited in many cases, maybe non-existent in others. So this is an outstanding lesson to, introduce someone to health and how health impacts their overall life. Lesson 8 is, again, making healthy choices and is self-advocacy, because, just deciding what you want and how you want it is a pretty big way that we express ourselves, and being able to choose for yourself, and not only just to choose, but making a healthy choice. So let's see, we also have explaining the importance of eating a balanced, nutritious diet as part of the curriculum. And lesson 11 is all about healthy food choices. We, like I said, we had interns who would have preferred to eat French fries every meal, or honey buns. Those are very popular. So we did a lot of work to help our interns, and we had interns who gained a bunch of weight over the fall semester. And so these lessons between making healthy choices, what is health, the impact between what you're eating and what you see on the scale and how your clothes fit, these were really valuable lessons for our interns. And I'm going to pass the ball over to Jessica, who's going to review just a little bit of how we implemented the curriculum, and we've got some really fun pictures for you. Oh, sorry here.
Okay, here we have some pictures of our interns on the day that we took them to vote. As Sandy mentioned, it was a great day for everyone involved. The lesson in itself, talking about rights and responsibilities, and then seeing it through all the way to them voting, was a great experience, and not only for us, but their parents were very proud as well. And the next pictures, we have our STEP challenge. When we addressed the lesson of exercise, we split our interns into 2 groups, and then the staff, the teacher, and the job coaches all participated in the challenge. All of the interns were given a pedometer to wear over the course of a month, and each day their steps were tracked, and there was a goal, and the first team to meet the goal won. They had a lot of fun with it. There were team captains that were appointed, and they were very creative with their posters. It was a lot of fun. It was a success. The interns were able to motivate each other and themselves, and then at the end, the winners got yogurt parfaits, and so that was a fun activity. The next one was an outing that we went on to the local YMCA. We were able to take a tour of the fitness center, along with participate in some of the classes that were offered, and see the outdoor activities as well. And with that, the YMCA actually gave us, and each intern, a month free pass to the YMCA. So that was nice that they could go on their own time for free. Here's a picture of us at the park. We went to the community park and did activities there just to show them, that exercising and getting out and being active can be fun, and doing it in different ways, not only like I had just mentioned the YMCA, but also going to the park. Oops. Let's go back. Yeah. So now I'm going to pass it over to Ms. Patty.
Today, so I feel like I'm a part of Texas now. I wanted to say that it is exciting how we also have been able to implement the HealthMatters curriculum, and the first thing that we chose to do was to join the senior exercise level 2 class weekly. And this entailed us coming off of rotation, and that last teaching hour, going up to our Career Technical Center and joining their Level 2 lab. We empowered them to also have the curriculum and put that in their hands, and they began going through that curriculum and setting it up and teaching each of those areas mentioned earlier in this presentation to the interns. So it was exciting to see that peer-to-peer interaction, and a lot of times we found that obviously you would see a different dynamic when they would hear it from their peers. And very exciting just to have that follow-up from what we've been saying. And we're in a hospital setting, so even what on their rotations, as they would encounter health and wellness type topics, that they would be able to just again be affirmed in what it is they're learning. One of the activities that we did was to walk from the Career Tech Center just down the road to a local store, thrift shop, to be able to go in and find some exercise clothes that would be appropriate to use. And again, being able to do this with our exercise buddies just made it that more fun and more realistic in regards to fashion that they would want to walk out in. So that was a nice opportunity to do that. Here you'll see that we're actually on the property stretching after a walk that we had taken, again, trying to meet people where they're at. We've had people from walking in a weight of 418 pounds all the way to, you know, that person that was very, very thin and underweight. So exciting to meet people exactly where they're at. Part of our weekly gathering was keeping personal journals and logging weight and seeing if we could see a difference throughout the year. This is inside the actual exercise science lab, and so not only did we do group activities, but they also broke down and were able to look at personal goals that each intern had, and then the exercise science students were able to really tailor and individualize programs specifically for a need. So if you think about somebody on rotation and you go and you take a look and say, you know, how could I do this rotation better, or what's it going to take? For some, stretching or moving a cart or bending, you know, they came back and were able to say, gosh, I need to be stronger upper body. What could I do for that? I want to be able to use the stairs instead of the elevator. I need to take some pounds off. So being able to network with each other, and then of course instructor and professionals to make realistic goals, and then be able to have the senior buddies create a program that would be a great way and a plan for them to carry out their goals. Another opportunity that we had was to be able to go to a local fitness center and do a program called cardio drumming. And I don't know if anybody's cardio drummed or not, but it's amazing. And I really recommend folks seeing if somebody in their community teaches a class, especially for people with disabilities. As soon as I took a class, I just knew that I had to have these interns be able to be exposed to this. The instructor stands in front of the interns that you see pictured here, and she puts music on, and she starts making movements, and all you do is follow along what the teacher does. It's almost like a Simon Says type deal. And it was very exciting, very energetic. We even got the senior buddies to come over at one point and do this with us. You know, this really captured the heart of a business person. So the person that owns this exercise area, turned out that she too walked in of health issues herself. She lost 123 pounds, and at age 50, her husband bought her this gym. She happened to be the bus driver of one of the gals you see pictured here, and she was a special needs aide in the school system for over 10 years. So it was exciting for her to see not only her own journey, but to recognize the growth and the desire and ability for somebody that she served so many years ago to become healthier. She posted a few pictures of this moment together, and within under an hour, we had a local business that paid for our classes for the rest of the year. So we were very, very pleased to have that support, and very excited to see others get on board and increase the class size as well. Here you can see the interns and also the senior class buddies explaining some of their projects. So as they were assigned different topics in regards to bullying, heart health, diabetes, what have you, very exciting then that they too had to take what they were learning and be able to explain that and tell our interns about them educating going both ways, which is very exciting to see. Another opportunity that we have been able to be a part of for the last 5 years is the Wilderness Inquiry Canoe Mobile coming into our city. This is an operation from Minnesota. These are 10-passenger canoes that you see in front of you. And right in front of that, you'll see a number of interns, wilderness staff, the exercise science 2 students, and then also a little white square there, if you can see, is the HealthMatters curriculum being utilized off-site. So we're excited to say then that we were able to take this into a local park, to be able to have an entire day focused on team building, health and wellness, being able to think about de-stressing in your neighborhood for free. Where could you go to take a walk after work? What could you do on a weekend, maybe at minimal cost? Maybe you can't rent a 10-passenger canoe, but could you do a pontoon or a paddle boat or a canoe? So it was very exciting, again, to see not only everybody coming together with the same idea of health and wellness, we also were able to incorporate different companies, parents, and other organizations to bring maybe a healthy snack or a healthy commercial throughout the day too, just to empower and increase the entire health topic that particular day. And with that, I will hand that back to
Okay, Pat. Thank you, Patty. We loved hearing about everything that you did in your program. We were kind of jealous, to be honest, with that canoe trip. Okay, so just some ideas for what we're doing this year with our cohort. I guess everybody in the country knows that we experienced some severe flooding in Houston and Texas in general. Was hit pretty hard by Hurricane Harvey. So I'm hopeful that we'll be able to do a lot of this because we are actually being hosted by the University of Houston at Sugar Land because our office building is closed. So we're going to do our best to get all of this in, but it is going to be a little bit more of a challenge than it would have been at UnitedHealthcare because, of course, we have access to nurses and all kinds of wonderful stuff at the office. So some of our ideas for 2017 and 2018 include having a nurse do our instructions in the following lessons: what is heart rate, what is blood pressure, what is cholesterol, what is diabetes, and what is heart disease. We feel like we could do these lessons if we really wanted to, but because we have that expertise available to us, we want to rely on it. And we will be able to get a nurse over to the University of Houston to do that lesson. But I had a thought for all those host sites out there that don't have access to the nurses like we do and aren't at a hospital. All schools have nurses, so you could easily invite your school nurse in to do some of these lessons. On whether or not they could do all of them or not is a question, but they could certainly do some of them. And the diabetes would be a great one to do because we know how devastating diabetes is to so many people. And of course, I personally could use the blood pressure lesson myself. But okay, so we also want to have a dietitian on staff at UnitedHealthcare who does our employee participation program. I'm not sure if I'm saying that right, but of course we're going to have to get her over here too. But we are going to have her do some lessons for us, including what nutrients we need. The healthy food choices, it is going to be much more impactful coming from her because she is a dietitian. There's lessons on how much should I eat, portion sizes, and the nutrients in our food. Again, you know, we are teachers. We are able to provide lessons for our students, and the curriculum is set out to where anybody can demonstrate the lesson and provide the lesson. But we have the expertise, so we just want to try and rely on that where we can. We are also going to be doing an ongoing tracking of water intake. Water intake is a pretty important factor in overall health, and it's not necessarily something all of our interns take into consideration. I know I don't, because I drink way too much Diet Coke, but I don't want our interns watching my bad behavior and not drinking their water. So that is something that we're going to be doing, is tracking water intake and doing some tracking too to see how that impacts their sleep, how it impacts their focus, and just seeing how it makes them feel better. We're going to be doing an ongoing step challenge with the interns and our on-site staff. We're probably going to have to wait until the spring semester to start that, because we are not in our office building at this time. But we found when we did that last year that some of our coworkers, the host business coworkers, were kind of jealous that we were doing this fun activity, and they wanted to be a part of it. So we are going to definitely let them be a part of it this year. And it was a really good exercise for the interns, because they are competitive, they wanted to win, and we could all tell an impact on how it made us feel and how our clothes fit also. And then finally, we're going to try to the best of our ability to incorporate the curriculum with the preparation and training of our host business, the UnitedHealthcare, and our Special Olympics Unified Sports Team. It's a new team that we're starting this year between our Project Search interns and our UnitedHealthcare Texas Community and State employees. We are going to have a bowling team, and we're actually starting in just a week or so to start that team for the first time. So we are really, really excited to see how that works out for us. Most of our interns are going to participate, and we hope that we're going to be able to include our interns from our past cohorts as well, because we want to kind of grow the family and always have connection with our interns, and especially in the area of health, because we want to make sure that they're living healthy lives. We want to make sure that they're staying employed. We want to make sure that they have the quality of life that they want and deserve. So, I'm sorry. Okay, I think, let me see, okay. We did want to open it up for questions and answers, and then I was asked to also give a brief overview of Project Search for the people that aren't familiar with it. Project Search is an international school-to-work training program for individuals with disabilities, specifically individuals with intellectual disabilities and autism, developmental disabilities. It is open to high school students who have completed their academic requirements, those first 4 years of core curriculum that have to be achieved in order to graduate from high school. And in the 5th year, it's available to students who are graduating by IEP to learn vocational skills, employability skills, the transferable and marketable skills that students with disabilities, need to learn in order to obtain and maintain employment in the community. It's a comprehensive program. It covers self-advocacy, time management, money management, obviously job skills on site, communicating with others, social skills. We touch independent living. It's really the whole person. So the interns are provided an opportunity at a host business. In our case, it's UnitedHealthcare. The original Project Search was in 1996, I believe, at the Cincinnati Children's Hospital. And since the beginning of the program, it has now grown to over 500 sites around the world. It's a phenomenal program. It is worth going to projectsearch.com and learning more about. Let's see, what else should I say about it, Jessica? Jessica says it's great. So, we are in our 4th year as a Project Search site at UnitedHealthcare, and the impact not only to the interns is phenomenal, but also to the people that work at UnitedHealthcare. It really is a life changer for everyone because it opens your eyes to what people can do, and not just kind of the idea of what we think individuals with intellectual and developmental disabilities, what they're capable of. They show us every day that that it's really about the ability and not the disability. They show us every day how wrong we are about, our ideas about limitations. So I think that's all. Are there any questions? We can take some questions if there are any.
Thanks, Sandy. This is Yasmina. If you have any questions, please put them in a question and answer box. That's the way we're going to get them, and I will read them out loud. It's just easier than doing it via voice at this point because we have many attendees.
Oh, okay.
So we will wait for
the
questions to come through via question and answer box.
The chat. Okay.
Yes, thank you, or a chat box. We have a question. Any recommendations on how to get pedometers for interns?
We actually did that. We actually made that purchase ourselves. You might be able to ask one of your local retail outlets, Academy, Walmart. They might be willing to donate those items, or at least, allow them to be sold at a discount. You can find them they're really not very expensive. We found some that were about, I want to say $8 a piece. Now, they weren't the best quality. They all didn't make it. Oh, okay, yeah. So in order to compensate for those that didn't work, that broke or whatnot, we ended up using our apps on our phones, which is another way to do it. If they have perhaps they have an Apple Watch, but they can always use their smartphone to track their steps.
Thanks. And from Patty, she said we're at the hospital setting and it was an incentive for employees and the hospital gave them to us. So all good. Another question, there's a couple of questions coming. If we were not at the conference that year, how can we get access to the curriculum?
I don't think it's accessible through the Project Search, either Schoology or the online resources that are available at projectsearch.com, but it is something that you can purchase. You can look for it online, and it is available for purchase.
Yes, Sandy, I can answer that. Yes, you can purchase.
Okay. Oh, I'm sorry.
I will put the link on the website. I think the question was if UnitedHealthcare was providing free curriculum. So.
I apologize.
Yeah.
I'm sorry.
So I don't know if it's still available through UnitedHealthcare for free. Does anyone know how to answer that from the presenters? The other presenters are on mute, so you'll have to unmute yourself if you have the answer for that. But I will post. I will just post the link to Amazon. Patty says contact your state search representative to get the new a copy. Any other questions? All right, I've also posted the Amazon link where you can purchase it. We have about 4 more minutes. We're going to stick around to see if there are any questions coming through. Other than that, the webinar was recorded and also captioned. We're going to make it available and send the email through when it's ready if you would like to share it with other colleagues. Thank you all for attending the webinar today. The next webinar is coming up in a couple of weeks on October 12th, and the topic is promoting health and leadership in project search programs. We will send out another email alerting you or reminding you to attend that one. Thank you. We're going to stick around. The presenters will stick around, but feel free to sign off if there are no questions. Have a great rest of the day. I think there are no other questions. We will stop now. Thank you all.